the emergency room. Medicaid, 48% is paid by private insurance, 14% is paid by Medicare, 15% is other, and 11% is paid by Medicaid. The negative constructive rests.
The affirmative team will have 4 minutes for their first rebuttal.
This is the first rebuttal for the affirmative constructive team. I am helping Mr. James with his rebuttal because he had a concussion yesterday and he had trouble remembering some of the things. So he's going to say half of the things and I'm going to say the other half.
So Mr. Monroe said, in 2001, 1 in 5 people were unsatisfied with Canadian healthcare. In 2007, this is a quote from Human Resources and Skills Development Canada.hrsd.ca. In 2007, 85.7% of Canadians said they were very satisfied. And during the negative cross-examination, the first one, they said the homicidal death rates were very high. And I have a question to that as to how high are they? Because they never stated. And then they also said this affects life expectancy rates, and I was confused as to how. And then they also said America has the highest heart disease and obesity, and that doesn't really have to do with healthcare. It has to do with fast food consumption because people in America are too poor to pay for their medical expenses because they pay so much for medical expenses. And then France's healthcare is a 2-tier system, which means you start out with a slight universal healthcare system, and then you can buy things from private healthcare systems. And that just adds more of a policy to yourself.
So, Mr. Skorab said that patients in countries with universal health care have a longer wait time when they go to the hospital, but that is not necessarily true with all the countries, because in Canada, yes, there was a high waiting list, which was 36% of patients in Canada said that there was a long waiting list. But America was not far behind from that, because 26% of Americans said that there was also a high waiting list. And in New Zealand, Australia, Germany, and the UK, most people said that the waiting list was shorter. So their information only really applies to Canada in this sense, because all the other states countries were lower. Also, the 61% of people in the United States said that getting care on weekdays, holidays, and weekends was hard, and the waiting lists were longer. Also, 38% of people in the UK said it was hard to get care on those days. Also, Germany, 22% of people in Germany said that. As you can see, 61% is much higher than 38 and 22. And those lower percentage countries have universal health care. Fern also, Ms. Cochran said universal health care is flawed. there are flaws, but a state in America, which is Massachusetts, has the closest thing to universal health care, and most of the people there are covered by health care. Also, they have enforced laws and they're trying to pass bills that will help keep the costs of insurance down, and they will still want to pay the doctors the same amount. Also, I have a quote from Barack Obama from the 2008 election, and it says, "My mother to die of cancer at the age of 53 and have to spend the last months of her life in the hospital room arguing with insurance companies, saying that this may be a pre-existing condition and they don't have to pay her treatment. There is something fundamentally wrong with that." So don't you think that when our own president says that there is a problem with our health insurance currently, don't you think that would be a bad thing?
Negative team, you will have 4 minutes for your second rebuttal.
Honorable judges, or the opponents, ladies and gentlemen, I would like to start off with answering some of your questions. You asked what the homicide and other rates in America were. The homicide rate alone in 2011 was 470,000. There were 470,000 homicides in America in 2011 alone. The negative constructive would like to clash with the affirmative on the following points. Number one, and the main point, that it is our national obligation to provide health care for those unwilling or unable to pay for their own. First, I would like to point out that the 10th Amendment of the Constitution of the United States says that the 10th Amendment of the Constitution of the United States says that those powers not delegated by this Constitution or restricted to the states are under the jurisdiction of the states and the people. This means that all powers not addressed or signed by the Constitution cannot be adopted by the national government, but the states and the people have the responsibility to take care of them, making universal health care unconstitutional. I would also like to point out that the individual states do, in fact, have programs to assist citizens without health care. Also, almost 100% of countries with universal health care are socialist. We believe this is no coincidence. We as Americans have a proud history of freedom and liberty for all, and this is not conducive to socialist ideals such as universal health care. We have the freedom to provide for ourselves or not. This debate comes down to one question. Do the American people have the rights, freedoms, and liberties to manage their own health care? With great power and privilege comes great responsibility. Facts are stubborn things, and we have related many facts, such as those by the Harvard Medical Institution, that America does have the third highest life expectancy rate if you remove all unnatural deaths from that statistic. Universal health care is unconstitutional and restricts the rights of Americans. Finally, as the affirmative has clearly not met its obligation to prove its case, and as the rules prevent it from introducing new contentions or evidence in its rebuttal, I'm sure that the judges will wish to award the debate to the negative constructive team. Thank you very much.
Affirmative team, you have 4 minutes for your final rebuttal.
The affirmative team would like to cover the 4 contentions we have with the negative side's case. They are brain drain, cost, taxes, and access to technology. I will now go further into detail. The negative team has assumed that a problem of universal health care is brain drain. The definition of brain drain is when doctors leave the country to find better work. But where would the doctors go? Even if we cut doctors' pay in half in order to accomplish our goals, the doctors would still be paid more than in other countries with universal health care. They would get paid less in every other place imaginable, such as Mexico, Canada, Africa, the Caribbean, or Europe. Again, I ask, where would they go? Contention number 2, cost. In America, we pay more than $7,500 per capita for health care. American specialized doctors get paid close to $500,000 a year. In countries like Canada and the UK, who have universal health care, they pay closer to $3,000 per capita for health care. Specialized doctors in universal health care countries get paid close to $300,000 a year. The negative constructive team stated that in Canada, specialized doctors receive extremely low wages. $300,000 is not a low wage. Can we all agree? Contention number 3, taxes. Our opponents assume that the raising of taxes will put people into debt. Universal health care raises taxes on all the people in the country. Although this sounds bad, paying for universal health care through taxes is still cheaper than out-of-pocket health care in the long run. When this happens, we add to taxes but take away insurance costs, which helps the cost issue. Everyone is paying for everyone. The rich and the richer might not like this, but it's cheaper in the long run. And just think about it, you're helping others receive health care too. Contention number 4, access to technology. Our opponent believes that with universal health care in place, that access to our medical technology will be scarce and the wait for medical tests will be longer. But universal health care will make people healthier. If everyone receives regular checkups, it will reduce the need for major tests to the point that only critically ill or injured patients will need the technology. Thank you very much.
All right, thank you to both teams and to our judges.